Hi all, I'm Bincy here. Today I am back with medical surgical topic, genitourinary system, that is kidney cancer. What is cancer cell and how does it differ from a normal cell is like? Normal cells are matured cells. Okay, cancerous cells are immature cells and getting easily multiplied. Okay, that is cancerous cells. So kidney cancer means cancerous cells is seen or associated in the kidney. Fine. There are two types of cancer, that is benign and malignant. When I say benign, that means it is not spreading. Okay, it is not spreading. When it is malignant, that means it's spreading. Fine. For example, I can say if a person is having breast cancer, only one breast is affected. If we give treatment for that breast cancer, okay, if it is benign, that means it is not spreading. Once we give the treatment, it is finished. Okay, but if it is metastasis or if it is malignant cancer, what happens is like through lymph nodes and all, that breast is getting affected, the other breast is also getting affected, and again from the lymph nodes and other organs, associated organs like lungs will get affected, throat will get affected. Okay, so it is spreading and it is causing diseases to the other nearby organs also. That is the malignant or metastasis. Fine. What are the etiology? Yeah, the main or the exact cause of cancer is still idiopathic or unknown. Okay, we can say it is due to over age, like over 40, then smoking, that is chain smokers, then obesity, hypertension or over drug usage such as NSAIDs, okay, or any chemotherapy drugs and all for long, or any what to say, diuretic drugs for long and all if you use, then long-term dialysis for long, I think for 5 years or more than 5 years, if you're continuously going and undergoing dialysis, that can also be the cause. Okay, then any history of any exposure to chemo or radiation therapy. Okay, any exposure to chemo and radiation therapy, these are the risk factors. Okay, the exact etiology is idiopathic. Fine. So now moving on to the stages of cancer. There are four stages of cancer. Okay, according to Robson, there are four stages of cancer. See, if I say the stages, it will be easy for you people to link and communicate with other cancers also. See, every stage of cancer is same. Okay, in this video I will be making it very brisk size or very easy size so that you can understand and you can write it by your own. Okay, so in the first stage is like tumor is confirmed. Now I am talking only about kidney, so I will be specifying only about kidney here. Okay, the other cancers and all you can just make it by your own. Fine. So if the tumor is affected in the kidney, that means only the kidney is affected. Fine, only the kidney is affected. The first stage, I am talking about the first stage, only the kidney is affected. Now the bombsman capsule and all is not affected. There is no involvement of that. Okay, only the kidney is affected. Then stage 2 means tumor is extended. Okay, and it is capsule is also getting involved. Fine. Stage 3 is like tumor is extended through the lymph nodes and extended to the renal vein or inferior vena cava. Fine. And the fourth stage is like tumor is invaded or spreaded to the organ adjacent to the kidney, means any close by organ to the kidney such as pancreas, bowel, etc. And then shows the evidence of distant spread to the organs such as lungs. So once the kidney is affected through lymph system, now pancreas is affected, bowel system is affected, now it will go up, 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 then it will get affected to the lungs also. Fine. So this was the stages of cancer. I repeat once again, there are four stages of cancer according to Robson. Okay, the first stage is which is the organ. Only that organ is affected, not the surroundings. Okay, in kidney, only kidney is affected, not the capsule. Fine. The second stage is like the kidney as well as the capsule is getting affected. Fine. The third stage is like through the lymph system. What happened, like kidney is affected through the lymph system and it is getting infected the nearby veins or arteries, whatever is associated. Okay, here it is getting associated with the renal vein and inferior vena cava. Fine. Then the fourth stage is like the tumor is spreaded towards the adjacent organs such as pancreas, bowel and all, and then the spreading is continuous and it is affecting the lungs also, the extended organ. Fine. So that was the stages. Then moving on to the clinical manifestation. See, we have fever and all. If we have allergy and all, or if we have fever and all, if some of the antigen is inserted in our body gives a sudden response for it. Yes, if dust, you are allergic to dust, and if some dust has been you have been inhaled by mistakenly, you will be sneezing it, right? Then you will understand, yes, I have dust allergy, because of this I am sneezing. Fine. Each and whatever disease is there, if you have drenched in rain and all, the next day automatically you will get fever, right? But what happens here is like, for carcinoma or for cancer, initial stages there is no signs and symptoms. That is why we are not able to get the cancer patient back to life. Yes, we can take it. It's not like that they are every patients are not, but actually I can say 45% of the patients have been not back to life. Cancer is not treated. If it is malignant, yes, it will be coming repeatedly. Okay, so majority of the cancers are asymptomatic. There is no symptoms and are detected incidentally by MRI or CT. See, if the person is well fine and all, he is having no problem, okay, or he or she is having no problem. Suddenly, some checkup is there. Just he went for a body checkup. That time only he got an affection that, or he got an information that he's been diagnosed with cancer and it is in the 3rd stage. Can't do anything. Then there will be slight back pain. In the case of kidney, there will be back pain or flank pain. Okay, abdominal urine color or due to hematuria. In the last stage, hematuria and all will be the present. Okay, then hydronephrosis. If you don't know hydronephrosis, go back and watch the video. Okay, polycythemia, fever, hypertension, anorexia, malaise and fatigues. These are be associated. Fine. Anemia will be there for the patient. Okay, that ankle pain or ankle swelling and all, it will be like pitting edema. Okay, then hypercalcemia, increased calcium in the blood. Then abdominal mass or lump. Okay, you can feel some mass or lump in the in case of breast cancer and all. How do we identify, how do we know, is like through self breast examination. Okay, it's like there are few stages and all. I'll be explaining it to you in the other video. If you people are interested, I can let you know in the other video. It's like we will be doing breast self examination. If there is any lump or mass is there, then we will be having a doubt. Because of that lump and mass only, we will go and do some diagnostic evaluations. Fine. The same way here also, certain small lumps will be there in the abdomen but not be seen in the first stage, because there is no pain and all, we don't bother about it, right? See, if suppose if you have a small lump in your hand, okay, here or not, if you have a lump in your hand and it is not paining at all, if you move your hand also, it's not paining, will you bother? It's okay, chalega, it's not paining, right? Let it be. It will go. It has come by own, it will go. We are like less bothered persons. But sometimes pus might get affected and later on your hand will get pain. Like I just said an example. Fine. Then later on, vision abnormalities will also be affected in the kidney clinical manifestation. Diagnostic evaluation, what and all can be done is like history collection, proper history collection, maybe any generation wise, if person is having cancer and all, then it will get affected. Okay, physical examination will be done. Okay, especially palpation and all. Fine. Inspection, palpation and all will be done. Urine analysis, blood test, cystoscopy will be done. CT, MRI, ultrasound, and the main one is biopsy. When we do the biopsy only, we will understand that the cells are immature and it getting multiplied very easily. That means we know that that cell is cancerous cell. So usually we do a biopsy. Fine. So now if you don't know biopsy, go back and watch the video of biopsy. Okay. Then moving on to the management. At the later stage of diseases, okay, the person has pain that will be like the pain will be like very severe, so we will be giving analgesics for them, for example diclofenac and acetaminophen. Okay, then antihypertensive drug, because drug BP has to be reduced. diuretics, as swellings and all will be there in the patient, especially in the leg, ankle swellings and all. So diuretics will be given for example, furosemide can be given. Then radiation therapy, chemotherapy. Okay, radiation therapy will be done, chemotherapy will be done. For in case of kidney, after doing chemotherapy and radiation therapy, still the disease is progressing, then we will go for a surgical management, that is nephrectomy. Okay, nephrectomy will be done, removal of the most primary known tumor from the kidney, that is nephrectomy. So this was all about kidney cancer. I hope you all understood. If there is any doubt, please get back to me. I'm here to clear out your doubts. Thank you. Bye.